Hi friends, I am Dr. Niranjan Naik, Senior Director of Surgical Oncology at Fortis Memorial Research Institute, Gurugram, Haryana. Today we are going to talk about the treatment options available for breast cancer. So breast cancer is the leading cancer among females all over the world, and it is number one cancer in India also. So there are a lot of questions come to mind whenever somebody is diagnosed with breast cancer. So as we all know, the cancer treatment is mainly multi-modality treatment. That means we include different modalities in the treatment, like surgery, surgical oncology, medical oncology, who give chemotherapy, then radiation oncologist who give radiotherapy, and other treatments like hormonal therapy, targeted therapy, immunotherapy, etc. So these treatments are tailor-made to each patient separately. So all patients, even with same stage and this like biological nature of the disease, are not treated in a single way. So there are so many points we take into consideration whenever we plan a treatment in cancer patients. The treatment involves systemic therapy as well as local therapy. Systemic therapy means the treatment which covers entire body, and local therapy means the treatment which involves the specific area where the disease is. Okay, now coming to breast cancer, treatment depends on the stage. There are factors which influence treatment. So mainly stage of the disease. So this is diagnosed, after the diagnosis we do staging workup with the whole body PET CT scan most of the time, and based on these and other investigations like biopsy, then there are some specific receptor markers are there, like estrogen receptor, progesterone receptor, HER2/neu receptor, and Ki67, and other few other markers also. Based on these markers as well as whole body PET CT scan report, the stage is decided and the nature of the cancer is decided, and then specific tailor-made treatment is planned. The other factors influencing the decision of which treatment to do is tumor size and tumor location, whether tumor is in single focus in one point in the breast, or whether it has multiple focus or multicentric disease, like in multiple areas of same breast. So these things make a difference. Then this estrogen receptor, herceptin receptor, HER2/neu receptor, progesterone receptor, and the involvement of axillary lymph nodes. There are lymph nodes in the underarms area, axilla. So they are also involved in most of the cases. So in those cases we have to decide some treatment accordingly. Then last but not the least is the patient's overall health and what patient wants, then patient's general condition, then other comorbidities like sugar, diabetes, hypertension and asthma or COPD, and these factors, what is the fitness of the patient. So these are all factors are considered before making the decision. Now coming to early stage disease, the like stage 1, stage 2. In stage 1 or stage 0 disease means where there is no definite bigger lump, but so only cancer cells are detected in the test. So that is stage 0, and stage 1 where the lump is less than 2 centimeter. In those cases, earlier we used to do surgery only. Now again, in some cases we have to do chemotherapy first based on the HER2/neu status report. So now coming to surgery part I will cover initially. So surgery is the most common surgery nowadays done, because we are getting more and more early stage diseases. So breast conservation surgery, where entire breast is not removed, only part involved is removed, and along with underarm lymph nodes are addressed, and we sometimes have to remove most of the lymph nodes, but again we assess underarms lymph node status by PET CT, as well as another technique at the time of surgery which is called Sentinel lymph node biopsy, SLNB. So in this Sentinel lymph node biopsy, at the time of surgery itself, we inject a specific dye and radioisotope which gets concentrated in the specific lymph node which is draining the area where the cancer is. So then we remove that lymph node and send it for testing, and during the surgery, when patient is under anesthesia, within half an hour we get the report whether that lymph node is involved by cancer or not. So if cancer is not involved by cancer, then we go for only sentinel lymph node biopsy. We don't do complete axillary lymph node dissection. But if it is involved by cancer, then we go for complete axillary lymph node dissection, especially level 1 and 2 in most of the cases. So this is breast conservation surgery. Then along with breast conservation surgery, we do some oncoplastic techniques, like to give better contour and shape to the breast so that patient will have a good cosmetic outcome. And in patients who have multicentric disease, where the multiple tumors are there in the breast, or very advanced breast cancer patients, we may not be able to save the breast. In such cases, we have to go for complete removal of breast. That is called modified radical mastectomy or MRM. So these are all the common surgery, and sometimes even in breast conservation surgery, if the breast size is not very big or tumor size is big, which leads to a bigger defect in the breast, in that case we have to do some tissue transfer from the other part of the body as a plastic surgical procedure. So that is called reconstructive breast cancer surgery, where we do additional tissue transfer from other parts of the body. So there are different options are available, and location of the tumor in the breast and size of the tumor and breast tumor ratio, the size of breast and size of the tumor, that ratio also helps in decision making. Then wherever we have to remove complete breast, then also we can do additional surgeries to reconstruct the breast. We take fat from the lower abdomen. Most of the ladies have additional extra fat in the lower abdomen, and then we transfer that fat to do the reconstruction in the breast, and thereby patient gets tummy tuck, that is flattening of her tummy, abdomen, and as well as breast reconstruction. So the patient have additional cosmetic benefit in this surgery. So thereby patient gets the reconstruction also. And in some cases, like especially who are patients who are aged, so most of the patients have pendulous or sagging breast, which is a little not very cosmetically appealing. In those cases, we can do therapeutic mammoplasty or reduction mammoplasty of the contralateral, the breast which is not affected, along with size reduction of the same side. So this gives a better younger looking image to the patient. And see, because breast is one of the most important organ for any lady, so it's an indicator of her feminine identity. So this is very important organ for a female. So having a good shape and sized breast will give us good significant psychological benefit and boost to the patient. Now coming to non-surgical options, surgery, mainly these things. Non-surgical options available are chemotherapy, then radiotherapy, hormonal therapy, targeted therapy, immunotherapy, etc. These are all very vast subjects, so we cannot cover them individually in detail, because there are so many options available in specific chemotherapy, hormonal therapy. Each individual has very multiple options available. So as I told, it is a multimodality treatment. So getting a treatment in a dedicated cancer center where everything is available under one roof makes the difference. So what is best for you? What is the, sometimes patient comes to us and they will say, Dr. Saab, you do surgery irrespective of whatever the stage. But no, there are specific guidelines available. It is not personal guidelines, it is international guidelines. There are so many guidelines available, like NCCN guidelines, ASCO guidelines, etc. So based on these guidelines, we decide what is, and based on all the investigative reports, we decide what is best for the patient and advise accordingly. So if you go for a comprehensive care center and treatment in a dedicated cancer center with all the facilities available, multi-modality treatment is available, and where we do a discussion called tumor board discussion. Most of the time all the consultants sit together and decide what is best for the patient. So with that, I will conclude this talk and wish you all good luck. Thank you very much.